To make sure that you are well prepared for the pregnancy and birth of your cat, you should be well informed about this topic. In this video we answer important questions and give you tips on how to recognize a pregnancy in your cat and what to look out for. How long are cats pregnant? As a rule, cats have a gestation period of 63 to 67 days. Signs of pregnancy. As with us humans, there are usually no physical signs of pregnancy in cats for the first few weeks either. After this time, however, there are the following characteristics. After about 15 to 18 days after becoming pregnant, your cat's teats will be swollen and take on a pink to reddish color. A cat can suffer from nausea and vomit just like we humans do. If you feel that she is uncomfortable or vomits very frequently, check with your veterinarian. A growing belly is also a sign of pregnancy. You should not touch it, so that you do not harm anyone. For a bloated belly, however, there are also diseases that come into question. Watch your cat well. Depending on the number of kittens your cat will gain between 1 to 2 kilograms. Increased appetite can also be a sign, but again, this can also be a symptom of a disease. If your cat suddenly wants to cuddle much more and seeks your closeness, this can also be a sign of pregnancy. Pregnancy can be detected in a cat by ultrasound when about 15 days have passed after mating. From the 40th day, the vet can also tell you approximately how many kittens your cat is expecting. Tips for the pregnancy of your cat. Petting and cuddling. Your cat needs much more love and affection during pregnancy. But be especially careful, and if the belly has already become plumper, you better avoid petting her there. If you have to lift her, make sure that she rests her hind legs on your hand. Vaccinate. If your cat has already received all the important vaccinations in advance, then there are advantages. Healthy dams can pass on their immunity to disease by nursing their kittens. It is best to have your vet test if there are enough antibodies or if further vaccinations are necessary. However, it should be noted that not all vaccinations may be given to pregnant cats. Parasites. Regular worming and flea treatment should be continued throughout your cat's pregnancy. This is because parasites can be passed on by the mother to her kittens in the worst case. However, inform yourself beforehand which medications will not harm the pregnant cat lady. Build a suitable place for the birth. Make sure your cat doesn't leave the house during the last 2 weeks of pregnancy, so she doesn't give birth to her kittens outside. You can build her a whelping box or something similar to make her comfortable before and during the birth. To do this, take a cardboard box and line it with clean sheets, comforter covers or towels. The kitten should not be able to get out of this easily, so make sure it is a good height. You will then place this in a quiet, warm place. Complications during pregnancy. There are several problems that can arise during pregnancy. For example, these are: your pregnant cat stops eating. She is distraught and restless, you notice blood or foul-smelling discharge, urinary tract infections, miscarriages and premature births. If your cat seems sick, appears to be in pain, or shows signs of a complication, be sure to have it checked out by a veterinarian. The birth of kittens. Usually cats have 3 to 6 kittens per litter. However, in the first litter, usually only 2 to 3 kittens. Signs of the upcoming birth. You should be well prepared for the end of the gestation period. It is always good to be on the spot to help your cat in case of complications. Signs you should watch out for. Your cat refuses to eat, becomes restless and looks for a quiet place. Your cat's body temperature is only about 37.8 degrees about 12 to 24 hours before delivery. Your cat becomes noisy, or constantly wants to groom itself. Pain and movements in the lower abdomen. Complications during labor. You should always be near your cat. In the following cases, you must help her and call a veterinarian. Long contractions for more than an hour and no kittens are in sight. Within 24 hours, still not all kittens have been born, not enough placentas in sight. This may indicate that there are still some remaining in her body. In spite of vigorous pushing, the kitten is not fully born. Complications after birth. Problems can also occur after birth. These may include: the mother is trembling, agitated or restless, the mother is still pushing even though all the kittens are born, the mother cat is not well, refuses her food, vomits or has a fever, her discharge is foul-smelling or contains fresh red blood, the mother cat's mammary glands become red and painful, you notice that some kittens are weak, suck poorly, or barely gaining weight. We hope that we could help you with this video. If you feel that there is something wrong with your cat or her kittens, it is better to go to the vet once too often than too little. It is always better if you are well informed and can help your cat optimally through the pregnancy. If you enjoyed this video, I would really appreciate a thumbs up. Also, don't forget to subscribe to this channel so you don't miss a new video in the future.